இந்த பகுதியை உங்களுக்கு வழங்குவோர் போர்னீஸ் பொட்டிக், சென்னை.
Half of the time they don't know why they are getting. So when you give retinol, you are actually stripping off the skin barrier, and the UV light can directly activate melanocyte. It's not strong enough, it's a counterproductive. So no melanosomes are formed, and so you get burnt. There are so much of inflammatory indicators, quick trigger, and they get burnt. In acanthosis nigricans, the principle is that you have very high melanocyte activity because of insulin. Insulin is a trigger. Now, first, and insulin also is a hyperkeratotic. So there is very thick keratinocytes. Turnover is also very high. So you have accumulated dead cells. For acanthosis treatment is reduce accumulated dead cells, bring the keratinocyte under control, then take all these antioxidants to reduce activity.
Ma'am, ready, ma'am?
Yeah.
Ready? All of you ready? Look at the camera, ma'am. Small. Thank you, ma'am.
Confidence and joy of women is through the shots in aging vagina. So the exciting area of today's medicine is regenerative procedures. Every day in the newspaper and Insta you can see ads about this PRP regimen for hair and the cosmetology clinics. So the reason is rising awareness about intimate wellness, internet accessibility, increased longevity of life, and everyone wants to reverse aging and maintain youth. So what are the physical changes with aging? Due to reduced estrogen level, genitourinary syndrome of menopause occurs, there is thinning of vaginal tissue, dryness, structural changes occur, and the pH increases. So the problem of GSM, vaginal symptoms, urinary symptoms, sexual symptoms. As age advances, the laxity, gravity increases, including the problem of aging. As you age, it is harder and harder to defeat gravity. So these are the vaginal symptoms: vaginal dryness, irritation, vaginitis. Combined also with botulinum toxin. The indications are orgasmic dysfunction, vulvar pain syndrome. Wrinkling in vulval or perineal skin or labial hypertrophy can be reduced with PRP injection and botulinum toxin. That is the commonest condition you are going to encounter in your future. Fillers will be more helpful. Changes. Next comes PRP plus stem cell therapy. Advanced areas where advanced tissue regeneration is needed, like lichen sclerosis, chronic atrophy, PRP plus stem cells can be used. PRP plus hormonal therapy is used in severe GSM, genitourinary syndrome of menopause, and atrophic vaginitis, estrogen and PRP. So you should advise the patient post-treatment also. Last week I got a patient, he had a PRP for face and hair. Again, he had this treatment in the morning, evening, fell off from the bike, went to a nearby clinic, he was given on NSAIDs. Again, me being a family doctor, next day they came, I couldn't tell anything. So proper post-treatment care is mandatory. No sexual activity, tampon use, contact for 48 hours after PRP injection. Mild swelling and tenderness are expected. Resume normal activity within 24 hours. Use only paracetamol for discomfort. Mild redness, swelling or bruising is normal. Avoid NSAID. Intercourse or vigorous physical activity should be avoided for 48 hours. Hot tubs, sauna, swimming pools also for 48 hours. Topical soothing gel or antibiotic cream may be prescribed if needed. Consideration. I think this is more important. Informed consent is essential. Avoid using patients with unrealistic expectation. PRP is not an FDA approved or globally standardized procedure for aesthetic ones. Clearly disclose this to the patient. and tell them that the treatment is experimental. Off-label PRP procedures must be conducted by a licensed medical professional and a credentialed person. Claims like reverse aging, guaranteed orgasm, tightening permanently are misleading. Individual results may vary. So, data privacy and confidentiality is also important. Protect all patient images and data used for before-after comparisons. Get written consent if any anonymized data or photos are to be used for educational or promotional purposes. The bigger reality, the rise of vaginal rejuvenation isn't just about wellness, it reflects deeper social pressures. Ideas around virginity, marriage, and ideal bodies still shape women's choices, often reinforcing patriarchal expectations. As awareness grows, the real shift must be towards choices driven by personal comfort, not by societal pressure. She should demand. She demands, she deserves, and she gets it. Thank you.
In Korea, they will basically package it for 1 year. Like you said, somebody was gifting for the gender. Yeah, so it is membership. In all beauty parlors in Korea, medical aesthetic centers, they have membership. So you take a 1 year membership, and that 1 year membership you can avail within that gamut whatever you want every month. Some will take cocktail, some will take procedure. So that's how it is. India will also become like that in future. So it depends on, I would say, what are we trying to achieve. For example, if let's say we are trying to give IV glutathione, right, as a nutraceutical. It has a specific half-life, and what we are trying to do is to reduce melanocyte activity. So the reactive oxygen species is activating the melanocytes, so more melanin formation, more melanin transfer, and that is a predisposing condition in many. This is triggered by hormonal condition which cause melasma. Now we want to reduce melanocyte activity, so we give antioxidants to reduce reactive oxygen species. That is why we give infusion. But that will not reduce the pigment because the melanosomes are already packed in the keratinocytes. So you need to exfoliate them. If you don't exfoliate, for it to exfoliate naturally, one epidermal layer takes 45 days. So 5 layers for the straighter granulosome to go up, it will take literally 3 months. So that is why you keep giving and you say you will see result after 2 months. Ideally, what you should do is to give 1 dose. After you know, tell the patient you won't see any result. So after 2 doses, probably weekly, once in 2 weeks, then you have brought the reactive oxygen species under control. Now melanocyte activity is under control. Now you exfoliate. So you exfoliate by chemical base, do whatever it is. Once you exfoliate, as long as you maintain this reduction in melanocyte activity, the results will last. How do you maintain? Do you want to give IV? Do you want to supplement oral? Or you tell them to correct their lifestyle, prevent development of reactive oxygen species. As long as they maintain the reduced melanocyte activity, you will be able to maintain the color of that pigment. That's how it is.
Ma'am, ready, ma'am? Ready? All of you ready? Look at them. Yeah, ma'am. Ready? Smile, ma'am. Wait. Thank you, ma'am. Ma'am, ready, ma'am? All of you ready? Look at the camera. Smile. Thank you. Ma'am, ma'am, ready, ma'am? Ready, smile. Please wait. Thank you, ma'am.
Join us. It's really not just that.
Ready, ma'am? Ready, look at the camera. Smile. Thank you, ma'am.
பகுதியை உங்களுக்கு வழங்கியோர் சாய் சங்கரா அக்யூ கேர், லா ஆஃப் அட்ராக்ஷன், சென்னை வலசரவாக்கம்.
இந்த பகுதியை உங்களுக்கு வழங்கியோர் அசீனா மேக் ஓவர் அண்ட் ஆரிவர், ராமநாதபுரம்.